Transcribe. Okay. All right, everybody, welcome. We are in the month of June and doing grand rounds. Very excited to have the crew from Elevation Health here. Tom also, good morning.
Good morning.
He's also here. Maggie and Heather, why don't you guys take a couple seconds and just kind of high-level overview of who you are and what you do, and then we'll toss it over to you to start sharing some really cool info.
Sure. Well, I'm Heather Peters. I'm a family nurse practitioner and CrossFit Level 2 coach. Um, and currently we own Elevation Health, which is a direct primary care office and home to Ash CrossFit.
And I'm Maggie Birdsell. I'm a registered dietitian and a diabetes educator and CrossFit Level 2 coach, and involved in every way that Heather just mentioned as well. So we'll talk a little bit more about our founding and when we opened and all of that when we start sharing our slides too.
Well, then let's get to it.
Yeah, I know. I would good because I was going to prompt you before you jumped into the clinical stuff because I know folks will want to hear a lot about kind of the nidus of how that started and developed over time and where you guys are now. So hopefully that's weaved in, and if not, I will pepper you afterwards and we'll extract it all from you.
Pepper is great. We love questions. That's
Yes.
the best part.
All right, guys, go for it.
There we go. So we wanted to just share like real stories, real life things that we have seen through our community and being networked together with primary care and the gym. So we'll talk about how that kind of transpired throughout this. This is our gym, the backside of it. Our primary care office is located here on the front. I don't know if you can tell that a lot from the picture, but then the gym is the backside of the building, and we actually have an outdoor rig here that you can't see, so we do indoor and outdoor workouts there.
About 6 months of the year.
Yeah, we have hard winters here, so.
And we're in Ashe County, North Carolina. So that's actually in the rural Appalachian Mountains. And a lot of people think we're close to Asheville because of that name, but we're actually about 2.5 to 3 hours north. So we're in the very northwest corner of North Carolina. We border Tennessee and Virginia. So just a little kind of orientation. Our whole county, so what we consider our community is our whole county, we have about 27,000 people as our population. So it gives you a little picture of who we're serving. We're home of Christmas trees. We're one of the nation's largest Christmas tree growing counties in the country. Lots of retirees and teachers. And so those are the people we're serving.
That's really great.
And we shared a little bit of this a minute ago, but of course, Maggie and I wear lots of different hats, as most business owners do. But as I shared, I'm a nurse practitioner and CrossFit Level 2 coach, but I'm also a mom and of 2 kids, 12-year-old twins, and stay busy with their activities. And I really enjoy workouts with a barbell. I'm not a cardio fan.
Cardio queen over there.
I'm not the cardio queen. It's this way. But so my husband, Marty Peters, and Maggie's husband, Travis Birdsell, are also involved in the gym side of things as co-owners. And Marty and I initially founded the gym in 2017 with a different partner at the time and she felt led to do some other things with her life. And then Maggie and Travis came along and we opened Elevation Health in 2019. And that just really, we didn't foresee the merge that would happen. We kind of at that time still visualized 2 different businesses, and it just organically merged together without us even like trying to make that happen.
Yeah, and of course, now looking back and talking with you all, it's like, it feels crazy that that wasn't part of the plan all along. But as you're stepping out and on your own venture to begin with, and we both were leaving our full-time jobs and stability to start our own direct primary care and nutrition practice, that was about all we could manage in our brains at the time. So, but then we found as Travis and I became involved in the gym, you can't go somewhere and talk about primary care and direct primary care, especially, and talk about nutrition and not talk about the gym. So,
That's amazing. Heather, that's probably the most badass doctor, nurse practitioner.
And wait, so full disclosure, I kind of snagged it because we're redoing our website, and so for the provider one, I got that there.
Oh,
We have a patient who owns a photography business, and he was
Oh,
like, "I want
good.
to come
So
take
good.
pictures for you guys," and
Oh,
he took
man.
that and made me look really like really great. And I was
So
like,
I was struggling to figure out how to embody like the persona of the healthcare provider on CrossFit on our new website that's coming out like next
Uh-huh.
week. And you sent that last week for the newsletter. I was like, okay.
Yeah,
he didn't make her
I
look
am
awesome. She is, so.
very jealous. I'm gonna photographer.
That's gonna
this
be
week.
why, that's really why Tom's gonna come down in a little bit. He's gonna want to work with a
Wow.
photographer.
We have some
Yeah.
really awesome ones he's done. You let me know when you're coming, and we'll line them up.
Okay, that's awesome.
When you guys started, was the DPC at the location it is now, adjacent to the gym, or were you in a different location to start?
No, we were in the same location.
Yeah. Okay,
Mhm.
cool. All right.
Yeah, we were. I had a background in traditional family medicine, and it just didn't match my values.
Oh yeah.
And as with a lot of providers who go the direct primary care route, our I don't want to go down a rabbit hole, but in my opinion, our traditional medical system's broken, and I couldn't give the quality of care that I
Yeah.
wanted to give. So,
Yeah.
yeah. So this is our day-to-day team operations, the people who keep it flowing. You want to introduce?
Sure. So we have kind of these are our full-time staff. We have a clinical nurse who works full-time in our direct primary care operation. We have a part-time phlebotomist where we do all the lab draws in-house. And then we have a full-time gym manager, Brent, in the CrossFit shirt. And so she runs the show at the gym and manages all of our other, additional coaches. So our full-time team is in the middle picture here, and then we have about 7 additional coaches that pick up classes for us across the week. And it's been really neat because pulling from such a big background. So we have, some coaches that have, like masters in health promotion and a lot of education in weightlifting and additional weightlifting certification. So we really just try to pull from people's passion and expertise and put them in areas that help them thrive.
And then kind of going into a little bit of how we operate. I won't read all of these off to you guys, but in operating the business, so that it matches the gym, we try to make sure that any staff we bring on matches our mission and our vision. And which essentially is like we want everybody to be able to thrive. We use the words health, function, performance, and community a lot if you sum it up in like 4 words. And we want everyone to feel like they're worthy and everyone to have the tools to be the best versions of themselves. And we do our best to try to equip them with that. And we'll get into some patient cases. So this fella here started with me in 2021, and he had hypertension. His big issue was he had a history. He worked as a lineman for years, and he struggled with having blood clots in his legs, and he'd been placed on Coumadin, which is a blood thinner. I guess most people know if they're on here, but he was really limited in his diet because with Coumadin, the levels can fluctuate so much in the blood based on what you're eating. And therefore had kidney stones, was dealing with some neuropathy. But I think the big thing was when we started working with him, we also found he was pre-diabetic and didn't know it. And then Maggie was able to work with him a lot on the nutrition piece. This was him and I, we had walked over from the clinic to the gym, and this was the first time he'd ever been on a rower.
Oh wow.
So
His
literally,
his form looks amazing for the first time.
I know.
yeah,
The jeans are a dead giveaway.
yeah. Yes, he's very long, so he's naturally gifted in the rowing department. But these were some of his metrics when he first started, like his blood pressure, when he came in, his body fat percentage, and then where his A1C, blood sugar, cholesterol, tried to include those. And then as we worked, Maggie worked with him. I'll let you share a little bit about that because we transitioned him from Coumadin to a different blood thinner so he could basically up his nutrition game.
Yep.
Yeah, and we use an InBody at our facility. So in conjunction with when we do labs, we try to do an InBody relatively close to the same time so we can use that data together. And so kind of throughout the slides, you'll be able to tell the InBody data is the orangish color and the lab data is blue. And he's a model patient. So essentially every time we sat down to meet together and work on his nutrition, he is a big guy. He's tall, he's a big guy, and really trying to get him to eat frequent enough was a big goal. So he still spent a lot of time traveling in the car early on, and so would eat breakfast and then not eat again until like late at night at dinner. So actually got him eating more and more frequently, more vegetables because of the change of the blood thinner, more leafy greens, and had just some really good results because he did everything that we talked about. He was
the model.
He's a model patient.
Can you talk a little bit about how you generated buy-in with him and because you can imagine talking with a guy with a handlebar mustache like that about eating. It's like,
yeah. So we definitely, we think of the three areas, our three services: primary care, nutrition, and fitness with the gym, as kind of our pillars. And we try to create those as three various access points. And so sometimes people come in just because they're interested in our model of direct primary care, which was his case. He was relatively new to the area and looking to transition his primary care provider. And so it was really just through being able to provide longer visits in that direct primary care model and listen to him and listen to his history. And Heather does a great job in just being a listener and not, helping guide people to what their personal goals are and personalizing it. So then the nutrition came in when he started seeing some of the, elevated blood sugars and elevated blood pressure. And then we tacked on the gym afterwards because, it was kind of one of those like, well, we need to build some muscle mass and we need to lower some of these markers. Let's go see what, it would look like to do some CrossFit classes. So it was kind of a layering approach, which I would say happens most often with our patients. Rarely do we have someone come in and say, I want to do all three. And actually our longevity and our retention rates are better when there is a layering in approach versus the person that comes in and is like, I want to do all three right now.
Yeah, no, that's very, very true and interesting. I think when you think about that from a habit stacking standpoint, right, that makes sense. Not trying to do too much too quickly; it's overwhelming. And we experience the same thing, right? One side feeds the other, and vice versa. People who've never done CrossFit before don't know what it is, right? Who come in through the practice side and end up getting exposed to it that way, and the opposite. So that's really cool. These numbers are unbelievable. How cool!
Very.
And I think too, to piggyback on that, when you can provide people with more metrics, like they're used to like blood pressure, heart rate, you
Mhm.
know, some of their labs, but oftentimes they've never even had an A1C.
Yeah.
And he's like, he's not someone that you look at and they look overweight,
Right.
right? But when you see his percent body fat for his actual body size, and when you can kind of talk through that and educate them on how to, you know, how to best remedy that, I think that also gives them a little buy-in.
Yeah.
Love all that.
Yeah. Really, really cool, you guys.
Yeah. So this is him just not too long ago. He competed. We have the New River here, and he competed in that kayak race 2 years in a row and won it.
Oh,
And
wow.
then did his first 5K and came in second in his age division.
Wow.
These other two guys are two of our members, and the one on the left here, he's actually one of our coaches. He loved it so much he went to get his L1 and become a coach. So
Amazing.
but yeah, and he was even able to get his blood pressure medicine from 20 milligrams down to 5. So even though he's still on medicine, he's on a lot less. So
Yeah, that's cool.
he's a pretty cool guy. This is another fella that started with us in 2020 and really didn't have a significant history other than we found he had elevated blood pressure and had not been diagnosed with hypertension. But to be honest, his biggest history was depression. He unfortunately lost a daughter to cancer around the age of 15. So that, of course, affected him tremendously. But we also discovered some other things like low vitamin D, and we worked with him, he and his wife, and one other uh, girl that's a coach of ours that they were our first members. Like
Oh,
they're our OGs.
yeah.
And he put in the work and worked with us, and we were really able to change some of his metrics as well, um, which you can see more so like we were focusing on like his lowering his body fat percentage and getting some of that more in a range that would fit his body and get his blood pressure under control.
Mm-hmm.
And then this is him now.
Wow.
He he lost weight. He loves to fish. He's an outdoor guy. Of course, his muscle mass improved. And you know, one thing a lot of people don't talk about with these changes is their improvement in their sex life.
Yeah.
And we actually polled some of these people to ask them if they had had that. And I mean, they that is definitely something that we find that I don't know if it's really documented places, but when you make these changes, there's an improvement there too.
Yeah, I mean, there's, obviously a multitude of reasons for that, but from a
Yeah,
biomarker standpoint, if you look at the testosterone improvement, I mean, you took your last gentleman from, a total of 500 up into the 800s,
Mhm.
that in and of itself is going to increase libido
Yeah,
and drive significantly. Not to mention what's going on, from a neurotransmitter standpoint and just elevated mood in general.
yeah.
So yeah, it's fantastic.
He did his first CrossFit competition this year, didn't he?
Yeah.
It was this
Oh,
year.
that's great.
They came in second, and they do adventure races, and we have a race here called the Blue Ridge Relay, where you want to explain that because you actually
It's
did
a
it.
running.
It's
relay.
running.
So they basically run from Grayson Highlands, Virginia. It's 200 miles to
Holy shit.
Nashville, and you have around 36 hours to do it. And usually our gym does a team of 12 in 2 vans, and you kind of rotate through. So
How fun.
Absolutely.
Yeah.
it's fun until you lose all the sleep.
Yeah, right.
It's fun until you run, in my opinion. But
Exactly right.
um, this lady started with us in 2022 and was dealing with some arthritis, just joint pain, more menopause type symptoms. She was really struggling to lose weight, had tried multiple areas, multiple diets, medications. But we found when she came, she was pre-diabetic. And then she actually wasn't going into menopause, she was postmenopausal. And of course was a little bit overweight. And so we worked with her more so around getting her pre-diabetes under control, and also trying to help her lose some weight and build muscle. For her, you can see she lost body fat, but she's maintained her muscle, doing both. So she's still working really hard, um, but has seen some improvements as far as like being able to reduce her depression medication. She came to me on multiple meds, and we were able to dial that back a little bit. Um, she's worked with Maggie quite a bit.
And so she definitely is one where, it's like one of those lifestyle changes that is a constant circle, right? And so there's going to be times where you take 2 steps back, and then you take 3 steps forward, and then you take 1 step back, and then you have the holidays, and then you take 3 steps forward. And I think that's more true for most people with behavior change. She was working with us from the primary care and nutrition side, and actually had a personal trainer out of a different person's home in the community. And so we were really excited when she decided to join our gym, because then we had a little bit more oversight on her fitness aspects of kind of what she was doing and how she was moving. And I will say that this is a case where, I mean, we could do a whole other presentation on this, but like it or not, this is where a little bit of GLP-1 medication actually helped this person get over that hump. And when you're working with somebody for 2+ years on lifestyle, and you just see the heartbreaking frustration of I'm making changes, I'm not getting results, to safely be able to help them get over that hump, but not abuse that medicine, and have proper tracking and track muscle mass versus body fat loss. I think this has been a real success story on how you can utilize some medicines at a very low dose and not ramp them up as fast as most providers will, and just really give your patient a win when they needed it, because they're doing the work. Their body just was not letting go, and not changing. So I'll say that was something that we utilized for her. And will we in the long run? Probably not. But with her being able to maintain her muscle and lose body fat, and even hopefully gain some muscle, she's changed her metabolic process. So I think she'll be able to keep it off.
Yeah, it's fantastic. The point that I always make when I'm talking about it with folks is that, it's, the class of medications in and of itself is not inherently bad, right? It's how they're utilized, right? And how it's wielded. And she's a perfect example of doing it, in a very appropriate manner, in that she's doing resistance training, right? You're able to have input into how she's mitigating any of the potential negative aspects like sarcopenic obesity or anything else, if she lost a drastic amount of weight too quickly and lost too much skeletal muscle, therefore making her more insulin resistant, etc. Right? Because she's training with you, you can ensure that she's working on her protein intake and she's lifting heavy stuff, right? And if she's doing those two things and you keep the medications at an appropriate level, right, it can really help people break through, as you alluded to. So
Yeah.
it's an example of doing it the right way and how it should be done.
Well, and as accessible as these medications had become, we wanted to be the ones in control of everything that you just said. In tracking, in lifting, in nutrition, and we recognize that if utilizing, the class of medicines meant helping people do it the right way, then in lieu of fighting it and being anti, let's show people what the right way looks like.
100%.
So.
Yeah, and it's far from anti. I think that from a medical profession standpoint, we have as much culpability in what's happening as anybody.
Yeah.
It's our responsibility, right, to educate and provide patients resources on how to utilize these safely, right? And so when you're doing informed decision making with somebody before they start, like you should be talking with them about how they're going to need to eat and what they should be doing from a physical activity standpoint to mitigate side effects, right? That's part of
Yeah,
shared
for
decision making and
sure.
informed consent before you start a medication. But how many times do people actually get that information, much less have a program that's going to allow them to be consistent, right? And that's what having the affiliate, right, connected
Mhm.
to the practice does. It's like not only can we do this safely, right, we can actually provide you the framework, right, to be able to execute on that. And that's what's missing, right? People don't have that opportunity. So it's really fantastic.
This fella just joined us last year. He's a newbie. But super great. Had some issues with anxiety. He had a history of some trauma, but manages that pretty well. Um, some sleep issues, a little bit of reflux, bowel things going on. And then we found when he came that his cholesterol was up, and he had low testosterone. So, in the year that he's been working, we did work with him. Maggie's worked with him somewhat on nutrition, but he's really like driven it home in the gym.
Oh,
I
yeah.
Look at
feel
that.
like
Yeah.
that's been his like tool that he's used. On the medical side of things, I feel like I've not done a whole lot, but he has really utilized the gym, and just in doing so, the testosterone increase there is just strictly from him putting on muscle, lowering
Yeah.
his body fat.
Mhm.
And I think it's cool to see that he actually gained weight, but gained muscle and lost body fat. And I always think that's really cool to be able to point out to patients, especially women more so than men, because they see that number on the scale move. And I know we all battle this, but when they see the number on the scale move and they feel like it's in the wrong direction, if you can show them that there's been like, hey, you gained muscle, like you're stronger. That is really cool to be able to give a patient that information.
It's interesting. We gave a talk last night to our affiliate, and I called it that body comp was the gateway drug to better health. And I think
Yeah.
that this is an example of
Mhm.
how potentially you guys alluded to generating buy-in and starting with one path and then being able to kind of layer it on so that that patient continues to kind of have a win, right? And
Yeah.
so feeling better in the gym and using that to help with mental health, and then seeing some benefits in the way that like mood can change and other types of important aspects of life, right, can just allow you then to continue down, making them a whole healthier human. So really
Yeah.
cool.
And his feedback actually was that he had
Oh,
noticed a significant decrease in the intensity and frequency and even the duration of when he would feel more depressed and anxious.
Yep.
Um, and he had some mobility improvement. He'd had some issues with that, and found that he had mobility improvement, and he changed his perception of how he looked at food, more as like fuel rather than for comfort. And then this is he and his wife. They actually competed in their first Murph this year.
wow. No,
So yeah, he's really embracing, and the community for him too has been big. They relocated here, and so having that community at the gym to network with, make friends, has been a real bonus for him.
yeah. Yeah, that's amazing. And I think just to highlight too the importance of, doing the in body, at least for me, in generating buy-in
Yeah.
for habit formation, right? Because as you alluded to, if somebody's just stepping on a scale and the needle doesn't move, much less see it go up, right?
Hmm.
And they don't have the framework to understand or interpret what that actually means, it can be disheartening, right?
Yeah.
So this really generates an opportunity to have a nuanced discussion about everything that they're doing from a nutrition and a training standpoint to keep them engaged and be like, no, you're really making good progress, and that can get lost unless you're looking a layer deeper. So it's a really good job.
Well, go ahead.
I was gonna say sometimes behavior change can be difficult to define. Some people do not want to track every little thing that they put in their mouth, and nor should they. But when we're talking about exercise and nutrition and just behavioral changes, one of the things I love about the InBody is that it summarizes those changes into numbers and it makes it a little bit more tangible. And so if the nutrition is matching up and on point and their lifestyle is, then the numbers change. If they don't, then it gives us more conversation. And so it's a great tool. And I'd say to any provider, like, it's an investment for sure. It's a financial investment in your business, but do it. It's worth it. It's one of those biggest tools that we've used to help people see below the surface. And I would even go so far as to say it's been the biggest referral tool from the primary care side over to the gym side. So we for sure drive from primary care more people to the gym than we pull from the gym into primary care in a setting. And I think the way Heather treats the patient and talks with them about their goals and their kind of medical status and the InBody has been a huge driver for that. So here's my InBody plug. I don't care what brand you use, but it's a brand. I'm not affiliated. They're not paying me to say that. Do body composition. It's worth it.
Yeah. And I think we're as a society, just kind of to piggyback on what you said, we're undoing a lot of things that, like my generation, I'm 45, like growing up in the 90s when everybody's supposed to be skinny and all the skinny over the counter meds were popular, and there was never anything about like be strong and healthy. And that mentally across the board for women and society, like that's a lot to undo. And when they start seeing their body makeup and how it affects their health, you can start to break that barrier a little bit.
Yeah, no, I think it's such an important point. I mean, I do, at least have some hope in that. I think we see more representations of strong, healthy women in media, but it's still an uphill battle. And as a dad of a young 12-year-old girl, right? It's something.
Yeah, it changes your mindset for sure.
Yeah, it's really important.
So this guy we included kind of for the flip side. He started in 2023, sleep apnea, some gallbladder issues, but we found when he joined, he actually was type 2 diabetic, low vitamin D, had some breathing issues, had hypertension, high cholesterol. And when he found all of that out, like his A1C was 10.8 on his initial lab check. He didn't even know it. And when he found that out, he really went to work. He was like, oh crap, I'm not living like this, and having some of those metrics. And he lowered his blood pressure himself. He lowered his A1C he declined medicine. Like he would not take the medicine. So he lowered it. He improved his improved his weight because he lost weight, improved his blood pressure. Unfortunately, we didn't have a beginning InBody on him because I don't know why we didn't have one, but we didn't have one. But he got a new job, stopped coming to the gym, stopped
hurricane,
and we had the hurricane in last fall, threw him off track. And so he let everything go. And so I included that just to show like what happened as a result of him letting everything go. Like, his weight came back up, his A1C is climbing again, his blood sugars are climbing. He and he didn't really know that until we checked his labs again. I think he thought he was kind of keeping a pulse on everything, but being able to point that out to him is kind of helping get him back on track.
Mhm.
Yeah, I was gonna say, how did he respond to that? Did he lean back into re-engaging?
Yes, he's trying. This was pretty recent.
Yeah.
So he started his own business and he's trying to figure out how to have that work-life balance. So he's doing some things and then gonna come back and recheck and reassess rather than give it a whole year. So
He also, when he made those changes, was very dead set on some diet choices that it was more along the lines of trying to put bumpers on his crash diet. And you know, you don't, as a practitioner, always see eye to eye with the diet choices. And for in this case, I very much use the term diet because that's what it was. It wasn't
Yeah.
as much, I don't think, lifestyle changes.
Yeah.
You know, granted, based on the initial reading, something drastic did need to happen, but there was a lot of times where I'm like, "Will you please just eat some blueberries before you?"
Right.
Just went really serious into the keto realm, much to my demise. Um, but you know, I think we've got a really great relationship, and so as Heather was saying, I think this goes to show what happens when you're rooted in a pretty good relationship with your patients. You're doing regular check-ins, and um, we're here, and I'm
Yeah.
here. And I think every time, you know, it's kind of chipping away and being able to be like, okay, now will you try this? Now will you try this? I'm patient. Now will you try this? You've done it your way. Now will you try it my way? You know, so
Yeah, I think you highlight a really important point, and this is such a great example of how, more strict nutrition strategy interventions can be really powerful medical tools. Like he essentially, cured his own diabetes, right, through a lifestyle concepts approach. The challenge, right, with something that is very restrictive is that it's very difficult to sustain over the medium and the long term, right? And how does that become something that you do for the rest of your life? And so understanding how you transition to something that's sustainable, for the next 20, 30, 40, 50 years, right, is where you can really use support so that you don't lose all of the benefits that you gained and have the challenges that he's faced. So it's a really, really good example of the power of habit, but also how having some coaching and guidance to make it sustainable over time is also really important.
Yeah.
I don't think we already
Yeah,
talked about
I
all
kind of
that.
pretty much just I talked about that. I didn't have another picture, but that's pretty much a recap of what we just said there. And this lady, she didn't want to, of course, share her photo, so we kind of found a stock photo that looks a lot like her.
Say what a cute old lady.
Actually resembles this really, and I wish she would have. It's a little bit different on how I use the InBody. So she has osteoporosis and vitamin D deficiency. Of course, it's postmenopausal. We did find when she joined the practice that she was pre-diabetic and had some vertigo issues. But her big thing was her worry was osteoporosis. So with her, I used the InBody to see what her muscle mass was. And educated her on the importance of having good muscle mass to combat osteoporosis. So she joined the gym and comes and does some strength workouts. She usually does open gym more, but she lowered her A1C and then over the 3-year time span, like was able to maintain and actually gain just a smidge of muscle as she's aged 3 more years, which I feel like is a win because if at that point, if you're aging and you're maintaining your muscle and not losing and you're battling osteoporosis, in my mind, that's a win. So we had, of course, had the flood in the fall. which was pretty traumatic. But she actually sent us a message during the flood and was able to pull all of her own carpet out of her house by herself.
Yeah.
And she was like, I would have never been able to do that before. She got two dogs that she keeps. She didn't think she would ever be able to have the energy or the ability to care for them, but now she has them. She gets up early, goes on hikes. She lives at home. I mean, she's 74. She safely lives at home independently, manages her own house. She's just really fascinating with her, I guess, her dedication to improving everything.
Yeah, and her latest kind of addition to her exercise routine is the ladder. So she
Yeah.
does ladder drills every time she
Oh,
comes to
great.
the
Mhm.
gym because she wanted to really work on making sure she was picking her feet up when she walked so that she was reducing her risk of falling.
Yeah.
So that's been really neat. So she does ladder drills every time she's in here. And as with many aging females, increasing her protein was really the biggest aspect of nutrition that we worked on. I think her blood sugars were slightly elevated, more so because of the low muscle mass, not because of her size. She's actually rather small.
Mhm.
But getting her to understand the importance of getting enough protein in and getting it frequently throughout the day has been a big win for her. So,
That's awesome.
This lady started in 2022. Anxiety and depression are probably her biggest battle. And then because of her anxiety and depression, she has a really hard time with food and her relationship with food. And then has some brain fog with that. We did find she had low vitamin D, but she's also very gritty and a worker. And when she came, her blood pressure was a little bit elevated. And she joined the gym and put in the work and has been able to reduce her body fat, reduce her weight, maintain her muscle. Um, she, as far as her depression and anxiety goes, it was greatly improving. But then the flood hit.
Yeah.
And so the data I have here is from 2023 because I don't have data on her another in-body since the flood. She does come in for her visits and still comes into the gym and still works with us. But I think the cool thing was that through the hurricane, she and the aftermath of that, even though she wasn't able to like focus so much on all of her medical issues, she was able to lean on us in the community for the mental health. And she didn't feel like coming, doing anything, but she would just show up in the gym and maybe just do some small movements. She wasn't busting it out in class, like doing max effort. But that was the one thing that she could control, I think, and she just kept trying to show up. So we helped be a base for her, and that was just really what she needed at that point.
Yeah, that's a good example of just showing up is enough sometimes, right? To help
Yeah.
people get through a really hard time.
Well, too, we talk a lot about this, that people's needs change over time.
Yeah,
I think I think one of the things that I struggle with as a provider is trying to fix or address everything at once.
for sure. Yeah.
And I need to sometimes step back and say, okay, what really matters at this point in this person's life is that they have connection to other humans.
Yeah.
And if they just can get in here and roll around on the ground and be around other people and maybe, smile once or twice, like that is probably the biggest intervention on their overall health that I can have, as opposed to trying to shove 15 things at them, telling them they got to do this, that, and the other, and making their stress and anxiety worse. Right.
Yeah.
Hey, you guys did a wonderful job with her.
yeah, and definitely trying to also just create a place where there's nobody feels any shame or judgment depending on like where they are in their journey. So, I think there was a point we also had a pretty cold, snowy, rough winter. So a lot of snow days. She homeschools her kids as well. And so there's one point this spring where I was like, I just want you to come in and you're just going to sit down and talk to me. She's like, but I'm not doing anything with my nutrition. I've been eating terrible. I was like, great, just come tell me how you're doing. We're going to put an appointment on the schedule every single week. And we're not going to talk about nutrition. You're going to tell me about how homeschooling's going. So just trying to be that community support.
Yeah. And honestly, I mean, just to highlight too, like, I think this is one of the reasons why integration of an affiliate is so fantastic for primary care, because it's a judgment-free zone and everyone is welcome, right? And there's so few places like that because we all have problems, right? And to be able to have a space where everybody is encouraging, everybody's positive, and everybody is welcome to work together, like that's foundational for doing good primary care. And it gave her exactly, what she needed at the time. It's great.
I think this is we got a video.
I got a video. Hold on.
Cool.
This is our last story.
No, you go ahead, because she was
Okay.
primarily yours.
So
So
this is a young lady who came to actually started CrossFit in Marty and Heather's garage in 2019. Particularly in North Carolina, we were mandated to shut down for 3-4 months with COVID-19. And at that time, she was in high school. She's a competitive softball player, an athlete. But in the summer of 2020, very much got influenced by social media around dropping weight to get faster, and kind of fell into that smaller is healthier mentality, and was trying to only take in somewhere around 16 to 1800 calories. And so she and her parents came to the practice and came to me and was like, I think we need to jump on this. Something is not right here. And so I do work with patients with disordered eating and eating disorders. Is it my favorite thing to work with? No, it's hard. But because of where we live, there's not really any other providers, particularly dietitians, that will take patients with disordered eating. And so I do. So we worked on really just education. So it wasn't as much, I would say, it was really lack of good education around fueling the body for performance. It was not as much a true eating disorder around body dysmorphia or anything like that. So we started working on a refeeding plan though, because as we'll see, the percent body fat had gotten really low. She also worked with Heather we did blood work so we could monitor her electrolytes and her levels, but she was down under 15% body fat at the age of 14. She had not lost her menstrual cycle, but it was pretty light, and I think we caught it early enough. But you'll actually notice that her resting heart rate was actually elevated. So her body was obviously under stress for that. So over working together, if you want to go back, we'll show her squat,
Okay.
and I'll kind of talk about the pre and post. But I can't let you go back.
what is that?
I don't know.
Can you use your arrow,
Maybe.
like on your keyboard?
Here we go. Let me try this. There we go.
So in this top corner of this video, this was her back squat.
The circle's in the way, but maybe you can tell a little bit.
2019.
Mhm.
So not bad, but not quite below parallel. Even a little bit. But anyways, over the course of the last 5 years, and with her to understand. Oh, I guess now.
Yeah. Okay, girl. Yeah.
Yeah, and
Oh,
understanding.
the front squat,
Yeah.
like that's the we went from.
Boy.
Yeah.
Yeah, we thought that was fun. So she does primary care. She's also now a CrossFit Level 1 coach and coaches for us when she's home in the summer. She plays Division I softball at Western Carolina, and was able to go in as an incoming freshman as one of the strongest on the team. Definitely the strongest freshman. And so she's actually, we wanted to include her story because of how it shows that not every story actually involves lowering body fat or lowering, eating less. There are plenty of individuals out there that need to understand their just relationship with their body, what they're capable of. And we thought this was a great success story around just an athlete who kind of tapped into everything we offer.
And I think this squat video is actually her with her freshman class at the softball team, the freshman from the softball team. And she set the record going in. Like she set the pace. Like nobody could do what she could do. So it made us feel really good. Like we, we're like, good job.
But I think that speaks to the importance of the CrossFit methodology foundationally, right? Obviously, nutrition is the base of the pyramid, which you guys addressed through kind of whatever, eating disorders that she came in with. But look at how it tips that sport specific performance, right? And so she was able to lay such a solid foundation through that and through training and through CrossFit, and then excel right at that top, little triangle at the top of the pyramid. So I love that example. Thank you for sharing
Well,
that.
she's also a great example of, part of the methodology, right? Fueling for performance, but not
Mhm.
it's a whole body of it. She was not fueling for performance, right? She
Right.
was on the trajectory of low energy availability on her way to relative energy efficiency, right? She was there with tachycardia and lighter menses starting to manifest and having those objective findings. And so, I mean, look at what you did for her, right? Completely turned it around. And as you alluded to, it was a lack of understanding and education. And so you're able to provide that and a means for her to actually move in the right direction. That's fantastic. What a great story.
Yeah, so that's the most of our stories we're sharing today. If anyone wants to get in touch with us, this is our contact information. The bottom picture is just a picture of our construction that's happening right now from the rebuild after the hurricane. We are temporarily located. Actually, across this parking lot up here is another building, which is the building my husband works out of. So we're in this building right now, hopefully to finish construction around the end of August or September, with our primary care part in the gym. So if anyone wants to reach out, feel free. We're happy to help any way we can.
Well, you guys have just highlighted so many wonderful things and are such a great example of the integration of high quality preventative primary care and the CrossFit methodology. And I am so thankful for, your work and sharing it with, everyone in the community so that they can learn and be inspired by what you've created. I think it's a fantastic model for what's going to be best about primary care in the future going forward. So kudos to you guys for everything that you've done.
I'll wrap up just real quick. I loved all of this from a expression of how, patient care and health interventions can be accessed through kind of the connection between the medical side and the affiliate. I think it would be really cool in a different forum in some capacity to unpack the business side of creating a DPC clinic that theoretically, and again, we don't have time to go into this, whether it operates within insurance, without insurance, how those revenue streams go back and forth. Because I think one of the barriers for this work branching out, right, is educating providers on how to handle the business side of stuff. So I think that that's a real opportunity for education for providers and stuff to get more involved in their communities with their local affiliates and other gyms. So I'm gonna just stick that in my pocket and then maybe
That sounds
go back
great.
around
Sure, yeah.
a little bit down the road, and we can unpack that, just in an educational platform as well. So
I
Yeah.
totally agree.
Thank you for giving us the opportunity
Yeah, thanks for
to
having us.
yeah.
our
Thank you, ladies.
all-stars and
That was
enjoyed
awesome.
it.
Thank you so much.
All right, I'm gonna stop the recording.